nice deep breaths in through the nose for a count of 4 and hold, and out through the nose for a count of 4 or 6. Letting the inhalations and exhalations get longer and deeper, taking nice deep breaths as you let the worries of the day go. You may like to close your eyes. Breathing in through the nose for a count of 4 and hold. Breathing out through the nose for a count of 4 or 6. Breathing in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4 or 6. And this is the principle of calm birth. Can be also used for non-pregnancy as well, for relaxation. And usually breathing in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4 is your general calm breath. So breathing in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4. And then if you're in a contraction or in pain, you can do the breathe out for the count of 6. So breathing in for the count of 4 and hold, and breathing out for a count of 6. Breathe in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4 or 6. And if you're not pregnant, you can use the breathing out for the count of 6 for any time you're in pain or severe stress. But in general, during labor, breathing out through the count of 6 is the procedure that's used for during a contraction. And in general, during labor or general pregnancy, you can breathe in for a count of 4 and hold, and breathing out for a count of 4. And you can do this anytime in any situation, whether you're planning a normal birth or if you get in a situation where you have an instrumental or cesarean birth. You can still use your calm breath to help relax you, center you, cope with any emotions or pain. And of course, best outcome for baby as well. Now we'll do progressive relaxation. Starting at the top of the head, relax, going down the back of the head, relax the occiput at the base of the skull, going down the back of the neck, relaxing all the tight muscles in the neck, back of the shoulders, going down the back, relaxing the upper back, the middle back and the lower back relaxes, including all the little spinal muscles that can get tight as well. Relaxing the buttocks and going down the back of the hamstrings, at the back of the thigh, going down the calf, relaxing the back of the calf and the ankle. Relax the heel, the sole of the foot, relaxing the toes, perhaps one at a time, and relaxing the top of the foot, the front of the calf, the knees, relaxing the thighs, all those big quadricep muscles that work hard holding you up. Relax. and relaxing into the pelvis, all the deep muscles there. The lower abdomen relax, middle and upper abdomen relax, and relaxing up the chest and diaphragm area, and relaxing up the front of the shoulder as you go down the arm, relaxing the biceps muscle, down the lower arm, the thumb, each of the fingers relax, and relaxing the palm and the back of the hand, going back up the arm, relaxing the elbow and the triceps at the back of the arm, and ensuring the shoulders are relaxed into the lower throat, relaxing all those muscles in the throat, relaxing the jaw, relaxing the mouth, relaxing the lips, the cheeks relax, and relaxing the nose, the eyes, into the eyebrows and temples relax, relaxing the forehead and the ears relax, relaxing the top of the head. And during birth and labor, it's really important to relax all the muscles in the face, in particular those around the mouth and the jaw. This can really help you. So relaxing, again, relaxing the forehead, the temples relax, relaxing the eyes and the eyeballs, the eyebrows, relaxing the cheeks, the nose, the upper lip, the lower lip, and the chin, relaxing the tongue and the mouth, ensuring the jaw is relaxed, and the chin, and then any other muscles in the face relax, relaxing any tension in the face, and relaxing the whole of the face and the head, relaxing all of the trunk of the body, and relaxing all of the lower body so that the whole of the body is relaxed. And then continuing on to your breath, in for a count of 4, and hold, and out through the nose for a count of 4. In through the nose for a count of 4, and hold, and out through the nose for a count of 4 or 6. Letting all the worries of the day go, and now practicing the J breath, which is a good one to use during the pushing stage of labor when it's time to practice pushing your baby out and then eventually pushing the baby out. So breathing down the body and out the pelvis in a J shape. So breathing down the body and out the pelvis in a J shape. That would be really beneficial to practice that. Just letting it go as you breathe out through the pelvis in a J shape. Push the baby out. Sometimes you might like to practice this in a supported squat position, or even a hands and knees position. They're all good positions to consider birthing your baby. Allowing gravity and allowing the shape of the pelvis to allow you to push the baby out easier. And now checking into a body part that feels particularly good today. Breathing into that body part, checking And then drawing to a body part that doesn't feel so good today. Breathing breath into that area. Sending love to the area. Checking in if there's any emotions that are stored there. And asking them to be released as you breathe in love. You might like to send a colour, perhaps a pink light of love, or another colour that your intuition suggests today to this area. It's not feeling so good. Get some attention. Always continuing to breathe throughout the meditation. Bringing attention to the baby, seeing how the baby feels today. For those that are pregnant currently, how does the baby feel? What can you sense about the baby? Is there anything that the baby needs today? Does the baby need any particular food, any particular position that you take, or any particular exercise? Does the baby need more fluids, more love, more positivity, or anything else? And of course, checking into yourself and seeing what your intuition says that you need today. Perhaps you need to eat something special, get a special type of exercise, more fluids, more love, more attention, a massage, a healing, whatever. And allow yourself to have permission to accept this. Giving thanks for any healing you received today or any messages during this process. Any insights, give thanks for that. Gratitude is important. And you might like to check in further and see if there's anything else that you need to do to help you heal or be replenished. Able to tune in to see what position the baby is in. That's an interesting one. Some people can sense it. Some people can sense when their labour is going to start by using their intuition in advance. And of course, if there's anything that you sense that's not quite right, always seek professional advice. No sense worrying. And if there is anything currently that doesn't feel quite right, ask what you can do now to support yourself while you're waiting for a professional appointment or advice. Perhaps you may continue on your breathing to help relax you and heal you for the moment. Doing that frequently can be helpful, and at the same time it's also practicing for that special time of labour and birth. So continue to breathe in through the nose, so count of 4 and hold. Breathing out through the nose, so count of 4 or 6. Breathing in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4 or 6. hopefully you feel relaxed. Now, this section is mainly for those that are getting closer to labour, but anyone can do it. So as you breathe there, checking into the baby and yourself and seeing what do you need for labour and birth. Is there any particular person you'd like to have there? Is there any particular foods that are healthy that you can bring along? Do you want to have candles or oils, any natural therapies? Who do you want to have there? Any particular midwives or care providers? Any particular support people? Perhaps your partner that you want to have there? See them being supportive. And feeling love for yourself and your baby. Giving yourself and the baby love, perhaps visualizing it in the form of beautiful pink colored light coming through your body and through the baby, sensing the connection. And seeing all the pregnant women of the world standing around you in this circle with their hands holding, and you're in the middle. They're all there supporting you. They're all there thinking of you. All these wonderful sisters who are pregnant and perhaps about to give birth, standing around you. It's amazing when you all get together, the support you can get. And these beautiful women standing around you, in the middle of them are standing the midwives and doulas of the world and other birth professionals. They're also standing in a circle with their hands held, sending you all the support and love and strength. And perhaps one of their souls will give you a message of what sort of things you might like to do during the birth. They're taking away all your fears as your fears float down the body and out the feet. Taking a nice deep breath out and breathing all your fears and tension out through the feet and out, away, wrapped in love and sent to the light. And we're visualizing it's actually time to go to where you're planning to birth as you're in active labor now. So looking around to see what you've got in your birth room, all the amazing things that you can have for your comforts. Perhaps you might like to put an affirmation poster up. And as previously mentioned, things like candles or oils. What positions do you naturally go to when you're in labour? Are there any particular exercises and practices that you're doing? Using all your senses to find what's in the room, all the positive things. What can you see? What can you smell, taste, feel, or hear? You might have some nice relaxing birth music or a meditation going in the background. There might be birds singing outside. You might want to go to the birth hall. Perhaps the lights are quite dim to make it favourable for relaxation and labour. You don't need bright lights now. You feel safe, you feel comfortable, and you're doing what your body is innately wanting to do. You have a healthy, happy, and positive mind, and you have healthy, happy, and positive people around you, all around you. And of course, there's times for privacy as well, perhaps you and your partner, or even you on your own. And seeing your baby moving into a good position favourable for labour as you relax there and breathe. Breathing in through the nose for a count of 4 and hold, and breathing out through the nose for a count of 4. In through the nose for a count of 4 and hold, and out through the nose for a count of 4. And perhaps while you're in a contraction, you might like to breathe in for a count of 4 and hold, and breathing out for a count of 6. Breathing in for a count of 4 and breathing out for a count of 6. Breathe in for a count of 4 and hold. Breathing out for a count of 6. And perhaps now practicing the J breath. So breathing down your body and out the pelvis in the shape of a J, visualizing the breath going down the body and out the pelvis in the shape of a J. And throughout the day you might like to practice this in a squatting or perhaps a hands and knee position. This is tending to be used at the time when you're in the pushing stage, when it's starting to push the baby out. And now we'll do the healthy birth practices, meditation. Continuing to take some breaths. And letting it all go. When you're ready, you can slowly start to blink open your eyes, perhaps wiggling your fingers or your toes. Coming back to the body, coming back to earth. Welcome back. the link of the Healthy Birth Practices meditation here for those who wish to do that